Oh, we're so aware.
We are the most aware people,
at least for
exist.
this year, that we've.
I'm so aware.
History.
I got 360 vision right now.
Yeah.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
Welcome back to another episode of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Michael Squires.
And I really wasn't lying when I said that October has so many health awareness elements to it. So last week, Dr. Michael and I were together and we were talking about Protect Your Hearing Month, which October is. And this week we are together and it's actually Children's Health Month. And we are not talking specifically about children, but we are going to talk about types of hearing loss that affect both children and adults.
Yep.
I think this officially brings to end the awarenesses
It's a
that
lot
October
of awareness
has.
in October.
Yeah, but understand that we are aware of all of them. I'm aware of the awarenesses now. We have properly identified them.
Yep.
We have acknowledged them. We have given you some tools in which to cope with them, and now we're done. We're good.
The awareness has been aware.
We're aware of the awarenesses, and the awareness is now over.
Yeah.
Got it? All right. So, Dr. Michael, I know that there are a myriad of types of hearing loss. So you can take us in whatever direction you want. You can talk about the super common. You can talk about the super obscure. And then, like a wide-eyed child, I will ask questions along the way. So by all means, choose your own adventure.
So I'm going to challenge that there's not a myriad of types of hearing losses, but there is a myriad of things that cause each type of hearing loss.
Got it.
Okay, so the types of hearing loss are actually really pretty simple. There is a sensorineural hearing loss.
Okay.
There's a conductive hearing loss, and then there's a mixed hearing loss, which, as you may have already ascertained, it's a combination of the two.
Got it.
So let's start with conductive, because we're not going to nail down on that one too much today. Conductive hearing loss is basically caused by anything that creates some difficulty with sound being conducted into the inner ear.
Okay.
So it's generally going to happen from the outside portion of the ear here all the way into what we call the middle ear space, or it might affect the ossicular chain, or the three little bones we all learn about in the fourth grade.
Sure.
Right? So conductive hearing loss can be caused by ear infections, or fluid, or earwax, or foreign objects, or anything like that.
So that all feels like temporary to me.
In many cases, it is.
Okay.
It's almost always going to warrant a medical referral to like a otologist or an ear, nose, and throat physician who's going to take a look and see if there's any medical plan of care that is corrective.
Got it.
There is such a thing as a permanent conductive hearing loss, in which case they've done everything that they can, and it would be more, in many cases, more damaging to try to do more than it would be to just treat the hearing loss that we have.
Just keep that bead in your ear for the rest of your life.
Well, maybe not the bead, but in some of those long-term chronic issues, that's something that'll happen there.
This will probably come as no surprise to anybody. Quick pivot. When I was a little kid, I thought this bead would perfectly fit in my nose. And so I put it up there. And then because as a child, I thought, well, now I need to get that bead out. I tried to dig it out and just managed to shove it up there.
Yeah.
Even further. As I said, no, it was, now we're going to go to your pediatric doctor and he's going to take these, what I assumed were torture instruments at the time, just long tweezers and just pop it out. But again, that probably doesn't surprise anybody that I would stick a bead up my nose, which was weird. And we went to
we still kind of expect.
Yeah, we went to this was all last year. I don't know why we went to a pediatrician. That was bizarre. All right, sorry, continue.
Yeah, well, secondary side quest. My daughter came home. We were putting her to bed. She was 3 at the time, and we were putting her to bed. I may have mentioned this in another episode at some point in history.
It's always great to remind people about a wonderful father.
We were putting her to bed, and she says, "Dad, I got some rocks in my ear." And I'm like, "Oh, haha, wait, what?" And so, of course, I have an otoscope at the house, and we took a peek, and she had loaded her ear canals with pea gravel.
Yeah.
So
I'm happy that A 3-year-old
Right
and
into
I are
surgery.
on the exact same page. That
Okay.
makes me super happy.
So that's conductive hearing loss.
Okay.
And she had a conductive hearing loss, but that didn't affect her ability to listen whenever we got those out.
Perfect.
So then the next is a sensorineural hearing loss. Okay. And as you might guess from the word sensorineural, this is kind of encompassing two different types of pathways. Okay. So there's a sensory hearing loss, which are generally going to affect the sensory cells. These are what we call the stereocilia, or the hair cells that are responsible for hearing within the cochlea.
Got it.
So this is going to be like noise-induced hearing loss, or congenital hearing losses in many cases, or ototoxicity, or anything that really affects those hair cells. And maybe we have an episode either that we've done or that'll come up either with Jordan or I that'll dig into the ear anatomy a little bit further. So
write that down.
There you go.
Producer Daniel, write that down.
Write it down. And then we'll go back and Daniel will put it on this episode so you can reference it.
We'll link to the future episode. So we'll go back to it. Write that down.
Well, we'll put you in a time warp.
We're going to put you in an actual time machine.
And then you'll have your AUD by the time you're done.
Perfect.
So, and then the other part of that is neural. There is such thing as a neural hearing loss. And if it's beyond the sensory components, oftentimes it's going to be a little bit further up in the hierarchy of how that sound travels up into the brain, what we refer to as way stations.
Got it.
That can be deemed as a neural hearing loss. In our world, they're lumped together because in most cases, they're treated the same way.
Okay. So what of those types do you predominantly see the most of?
Yeah, most of the time we are treating sensorineural hearing losses because we're going to refer out those conductive hearing losses. If it's a chronic conductive hearing loss that is going to be permanent in nature, we can treat those as well. And most of the time we're looking at like hearing aids to treat that, or like an osseointegrated device.
So what would wild tangent? What would like a perforated eardrum be? Is that conductive?
That would be conductive.
Okay.
Yep.
And then just
if that causes a hearing loss,
that
hearing loss would most likely be conductive.
And then would tinnitus fall under what? Or is that just its own? We don't have to get into that.
Ooh, that's a deep one. So tinnitus is not a type of hearing loss. Tinnitus is a symptom of something else. That symptom is generally, it can be related to hearing loss for sure, or a sudden change in hearing. So I have had patients report tinnitus with a ruptured eardrum. Just because it's such a change, your brain kind of freaks out a little bit and kind of creates some stimulation. But most generally, that tinnitus is going to be transient. With a sensorineural hearing loss, if it is the culprit for the tinnitus, then it's not going to be transient. Generally, it's going to hang around.
And so if I'm one of our very smart, very beautiful, very kind listeners, my follow-up question would be, so then how do we treat sensorineural hearing loss?
Yeah. So there is no way in the medical world to treat a sensorineural hearing loss through like medicine or drugs or surgery or anything like that.
Got it.
Well, with one exception that I'll tell you about here in a second. In most cases, it's going to be with hearing aids.
Got it.
Because what we have to do is we have to overcome the difference in what our sensory skills should be and what they are. And once we can overcome that, then the brain can pick up on those signals generally pretty well, depending on the degree of hearing loss. Now, the caveat there is if the hearing loss is to a point that a cochlear implant is needed. In which case there is a surgical solution there.
And so acknowledging all the awarenesses this month, and acknowledging that it's Child's Health Month, but that hearing loss affects human beings equally.
Sure. If
somebody is suffering from hearing loss, or they know somebody that is suffering from hearing loss, what should they do?
Yeah, if you have, so let's talk specifically about a child for a moment. If you have a concern about your child or a grandchild or anything like that, that's a great conversation to have with a pediatrician who can then refer you to a pediatric audiologist. I can't stress that enough. Call ahead to wherever you're being referred and just make sure that they've got a history of seeing pediatrics. Pediatric audiology is not the same thing as audiology with adults.
Got it.
It's a very different ball of wax, and some people are much more skilled at seeing pediatrics than others. But in terms of the general population, if you or a loved one are experiencing some difficulty, call an audiologist or talk to your primary care physician and ask them to refer you to an audiologist who specializes in treatment of sensorineural hearing loss. Because what they're going to do is they're going to give you a great baseline, and then you've got something to compare that to. And if you can compare back to a baseline, you know how much change is happening over a duration of time, but you also can get some really good recommendations for treatment of that hearing loss if it's already present. Long-term untreated hearing loss comes with a whole host, talk about being aware, a whole host of really icky and negative side effects.
Agreed.
We're talking cognition, we're talking fall risk, and on and on. And so it's always a recommendation to get a good baseline and treat a hearing loss if it's present. Don't be big and bad and ignore a problem when it's there.
And if you find yourself needing just a few more touch points before you pick up that phone and call, feel free to head on over to askanaudiologist.com and we can get in depth about all the different types of hearing loss, which there's only 3, and how it could be affecting you. And if you see some of the evidence that feels like it's being discussed about you, then that's when you pick up the phone and call your provider. Dr. Michael, we're officially out of All Awareness October month. You did a bang-up job.
Oh, we're so aware.
We are the most aware people,
at least for this year, that we've
I'm so aware.
In history.
I got 360 vision right now.
Yeah.
We'll see you guys next week.
Bye.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.